My name is Sue Flanagan, and I'm from Blue Cross and Blue Shield of Massachusetts. I first want to thank everybody so much for coming out tonight. What a great crowd. This presentation should run about an hour, and the way that we do this presentation is that I really go through one topic at a time, and then I stop and see if anybody has questions, and that way the presentation really stays organized for everyone. It's a very detailed presentation, but also general information. So I'd like to put that up front that it's really not going through Blue Cross products, but what this presentation tries to do is say when you're going on to Medicare, or we're coming up to the open enrollment in October. So if you're going on to Medicare or you're already on Medicare, it's going to answer some of those questions that people have. First question is, what is Medicare, when and how to enroll? And then the second question is, once I'm on Medicare, what are the types of plans that go along with Medicare? And we'll look at Medicare Supplement versus Medicare Advantage plans. Just from my understanding, how many people are just going on to Medicare for the first time? Okay, so a lot of you, great. And then how many people are in here that are already on Medicare kind of looking to see what's coming up in the new upcoming open enrollment? Okay, great, so about 50-50. So if you are on one of those plans already, you probably know that every year you can relook at your plans, and you would relook at those plans October 15th through December 7th for January 1st effective date. So I always want to be looking at the plans. Typically the plans send their updates before October 1st, but we can't talk about any plan changes until October 1st. So did anybody get their plan changes yet from their health plans? No. So you probably should in the next couple of weeks. And then if you're happy with the plan that you're on, it just continues to carry over. And if you're not happy with it, that's the time that you can change every year. So we'll get started planning for Medicare. The first section is really all about Medicare and the Medicare-related options. And the second section is, well, what if you're retiring at age 65, but your spouse is only 63, or you're 63 and your spouse is 65, what happens in that time frame? And that's really only a couple minute part of the presentation that we'll go through. So everybody will have a handout. You feel free to look at the handout or look at the screen. Hold on 1 second. I'm just going to grab a few more chairs. Okay, great. So this slide right here is really an overview of what we're going to talk about here tonight, and also an overview of the landscape of Medicare. So what it's showing you is that once you go on to Medicare, you could have Medicare alone and nothing else. And a very oversimplification of Medicare is that it's an 80-20 plan. Medicare covers you 80%, you pay 20%. Allowed to go to any doctor, any hospital. It takes Medicare, no referral. Oversimplification of Medicare, but that's your starting point. You always need Medicare. If you want more coverage than Medicare, then you would look to a private insurance company for that additional coverage. If you work for a company or the town or the state or somebody for, let's say, 20 years, before you leave that employer, you always want to ask, do I have retiree medical coverage? And if you do, you're usually choosing from what that company offers you. You've worked all those years, you have this benefit, and usually if you don't take it, and then you later on want to get back onto it, you can. That's not always true, but most of the time, if you have a retiree medical plan, usually best to take it, try it out. If you're not happy, then you could leave it at that time, but most people should be taking their retiree medical coverage. But not everybody has that. Most people actually don't. So if you don't have retiree coverage, you're going to be buying insurance on your own. And then there's always these two pathways that you can go down. We're going to talk about the Medicare supplement pathway first. This pathway is typically the most expensive monthly pathway to go down, but the least amount of money out of your pocket as you see those doctors or those hospitals. So that pathway, it's filling in the gaps where Medicare left off. It's picking up that 20%. It doesn't add in a lot of extras that you might see advertised on TV. The money towards your glasses, dental, and you have to buy a separate prescription drug plan. So that's one pathway. A whole other way of doing things are called Medicare Advantage plans. And there's an or in the middle of the page because you never do both. It's always one way or the other. In a Medicare Advantage plan, those are some of those HMOs and PPOs. If you watch TV, you've definitely seen a commercial for it. Zero premium plan, I think it's Joe Namath or other celebrity endorsements. Money towards your glasses, dental. So these plans typically lower premium, extra benefits, but pay some co-payments and costs along the way. Neither pathway is ever better than the other. It's just a weights and balance of what you're looking for to do. And that's what we're going to talk about in today's presentation. We start with Medicare though, because what we find is if you understand Medicare, then everything else after that makes a lot more sense. So I'm going to go through Medicare first, and then I'm going to stop and see if there's any questions on Medicare. So Medicare is health insurance provided by the federal government. It's broken down into two parts. We have Medicare Part A and Medicare Part B. Part A is your inpatient care. I can get you a chair. I think, is there? Sorry.
She left. She appeared over here.
Just in case. All right. Sorry about that. So Medicare broken down into two parts. We have Medicare Part A and Medicare Part B. When you think about Part A, you want to think about your hospitalization and your skilled nursing. So hospitalization is your room and board, lab, equipment, everything you're doing in that hospital minus your doctor care. So doctor care always falls under Part B, whether you're in or out of the hospital. And Part B is also all of your outpatient services, your labs, your x-rays, MRIs. Part A is premium free. Part B is $174.70 per person per month. If you're collecting Social Security and you go on to Medicare, they'll automatically take that out of your Social Security check. You may decide to go on to Medicare at age 65, and maybe you're not going to collect Social Security until you're 67 or 70, and that's perfectly fine. What would happen is you would just pay that $174.70 to Social Security on a quarterly basis. That figure typically changes every January 1st. It's not released yet from Medicare, but it typically goes up a little bit every year on January 1st. So it should be released in the next few weeks. And then if you are in a higher income bracket, and that would be if you make more than $103,000 as an individual or $206,000 as a married couple, you may pay more for that Part B, and I'll have a resource slide at the back that will show you all those income brackets, and Social Security would let you know that. But for most people, it's that $174.70. And then with Medicare, you can go to any doctor, any hospital again, no referral, nationwide coverage. I say any, it's any Medicare provider, but most doctors take Medicare. So it's much harder to find the doctors that don't than it is to find the doctors that do. Medicare will also always be there for you when you're sick, problem diagnosis, just doesn't cover all of the costs. Again, it's that 80-20 plan with some deductibles, and we'll see that on some upcoming slides. So, if you're new or approaching age 65, I can almost guarantee somebody has told you that you have to take Medicare, or there's a lot of misinformation out there. So you may or may not have to. It all depends on your personal situation. And what we find is that most people will find themselves in one of the next 3 brackets that we'll go through. So the first bracket would be if you're turning 65 and you're already collecting Social Security, you should automatically receive your Medicare card 2 to 3 months prior to your 65th birthday. So let's say your birthday was May 1st, say May 20th. You would start to see your card arrive a few months prior, and it would start on May 1st for you. But let's say your birthday was May 1st, for some reason Medicare always, anybody on the 1st of the month, they start either 1st of the previous month. So that person, if you're born on May 1st, your Medicare would start April 1st. And again, automatically comes if you're collecting Social Security. If you're not collecting Social Security and you want your Medicare to begin, nothing happens automatically. So you do need to initiate that process, and you should do that about 2 to 3 months prior. So your Medicare will start the first day of the month of your 65th birthday. You do have the month of and the month after to sign up, but if you sign up at that point, there'll be a delay. So it's never going to start the first day of the month. And then the last group of people would be people that are continuing to work past age 65. So if you say, well, what if I'm working past age 65? Do I have to take Medicare? The first question would be, what is the size of your employer? So if your employer is under 20 employees, typically, yes, you do need to take Medicare A or B. If your employer is more than 20 employees, then your employer plan is primary. And you can delay signing up for both A and B past age 65 as long as you or your spouse are actively working and have group insurance through that active employment status. So what does that mean? Let's say you worked at a hospital, well more than 20 employees, and you're coming up at age 65 and you say, I'm going to work until I'm 70. You can just stay on that hospital insurance. You don't have to sign up for Medicare A or B. When you go down to Social Security when you're retiring, they're going to say, where were you at age 65? And you would say, I'm actively working with health insurance through an employer. There'll be a form for your employer to fill out, and then you'll be able to go on to Medicare without any penalties. At that point in time, what would happen is, let's say you say, I want to retire July 1st so that I have the whole summer. So July 1st, they're going to give you Medicare Part B. But if you didn't sign up for Part A when you turned 65, they backdate that 6 months for some reason. So Medicare Part B would start July 1st. Part A is premium free, remember, so it doesn't matter. They're going to backdate that 6 months if you work past age 65. Why do I mention that? The only reason I do is that if you are on a high deductible plan and you've tiered it with an HSA, a health savings account, contributions to a health savings account in Medicare do not, it can't be. So what you want to make sure is that they're not compatible. You're not allowed to be contributing to an HSA. You're on any form of Medicare. So So sometimes people will turn 65, they're still working, they have a health plan, that might be a high deductible plan, and they paired it with an HSA or the employer's paying towards it. You can still stay on that as long as you don't sign up for Medicare A or B, but just be aware that when you retire, that they'll backdate the Part A 6 months. So that's why sometimes when you're reading about high deductible plans and HSAs, they say stop contributing 6 months prior if you're working past age 65. If you don't have a high deductible plan that's paired with an HSA, a lot of times when people turn 65, they're just going to sign up for Part A. Part A is free. If you ever end up in the hospital, it might coordinate some benefits. Again, your employer plan would be primary, but you can have that Part A, but don't sign up for Part B because you don't want to be paying that premium when, again, your employer plan is primary. So I'm going to stop right here. We typically have some questions at this point. Any questions that I can help people with? Yeah, sure.
So if there's less than 20 employees and they sign up for Part A but not Part B, when they stop working, can they still sign up for B, or should they sign up for both?
If it's her question is about less than 20 employees. So less than 20 employees, why it's broken down is the law is if it's more than 20 employees, everybody's treated the same. So just because you're 65, you don't have to come off an employer plan, take Medicare. But under 20 employees, the employers are not required. So it's going to be different what the rule would be with really each employer and which each health plan that they've contracted with. So for under 20 employees, I wouldn't be able to answer. You'd want to go back. But typically, her question is, can I only take A and then take B later? We typically say take A and B because at any point in time, maybe they're covering fully, but if they decided not to, that you could be stuck with that 20%. So to be safe, most people take A and B.
So going back to the cost of Part B, I've heard it's based on 2 years of tax forms or income prior to your 65th birthday, or?
We'll go through that now. Her question is about the Part B for the higher income bracket. We typically go through it. I just showed this at the end, but I'm just going to go through it now since the question came up. Typically, Part B is $174.70 per person per month. But again, if you're in that higher income bracket, you may pay more for Part B and also Part B. What they do is they do a 2-year look back. They look at your last tax return, which is essentially 2 years back. And that's how they're determining what you would pay for Part B. Now, if your income was higher because you were working and now you're retiring, you can appeal that as a life event. So life events would be like retirement, divorce, death. But if it was capital gains, you sold your house, you typically don't win those appeals. You can appeal anything, but it typically falls under those life events. So if you're paying more and you're retired, you can appeal it right through Social Security. But if you do nothing, every year that look back keeps happening. So you're never always paying that price. It's always off of your last tax return. So somebody might go onto Medicare and pay more. Somebody might go onto Medicare and not pay and then have a great year somehow and have to pay more. So
you would sign up for it and then appeal it, or?
yeah, I mean, once you're on Medicare, you sign up, you're getting the premium based on your last tax return. So most people are going to pay the $174, but if it's higher, you're going to pay that unless there's some type of appeal process that you can do. Yeah.
So just throw back to the Plan A, Plan B options. So if I'm a subscriber with an employer who has more than 20 employers, and my husband is also covered under a family plan, is there any drawback for him signing up for Part A, even though he'll continue to work and he'll be covered under my insurance?
Her question is, if your spouse is on your plan, you're working more than 20 employees,
Contributing to
contributing,
HSA.
contributing to HSA, is
My
there,
deductible would be.
you, but any, drawback for the spouse to sign up for Part A? No, the spouse, because it's not connected to the HSA, can sign up for Medicare if you choose to do so. Again, Part A doesn't typically help you, but sometimes it may if you end up in the hospital.
If you convert an IRA to a Roth, and that puts you over the limit, is that a life event? Because it's not normal income, it's.
You know, I'm sorry, for his question is like if you, for the, specific question on the Part B and Part D premiums of what they're looking at for life events, I can tell you the basics,
Okay.
you know.
So it's an appealable event, which you may or may not grant.
I can say against that,
Sure.
because that happened to me.
Can you repeat the question, too, Cory?
It happened to me because I had a high income during the pandemic, so I was charged the third one down. So I called Social Security, I went into their office and they made it back down to back at the time, it was $90,000. And they just didn't count it.
So as long as you appeal it.
Yeah, they usually don't, they just do it right away.
Okay, thank you.
Depending on
Yeah.
the circumstances.
But usually
to be
like that
clear.
kind of income is a yearly thing, it doesn't happen every year.
Right.
They may say I need 20 grand extra this year, but next year you don't need it.
Yeah.
So it's like a one-time event.
Okay.
So glad you had that experience. All I can offer is they go off of the modified adjusted gross income,
Very good.
so whatever that is. Thank you. Okay. Any other questions on when and how to enroll into Medicare? I always just like to make a note, like, this is very specific, actively working with health insurance through that employer. So COBRA doesn't count as actively working. I just don't want anybody to get stuck with a penalty. And if one spouse is working, but one spouse is retired and the retiree coverage is through the non-working spouse, that's still not connected. So it's actively working with health insurance through that employer of the actively working person. And any questions, you can always go back to Social Security.
Didn't it used to be mandatory that you take Part A under 65? This says optional.
Yeah, no, it's not mandatory to take Part A. Everyone thinks it was, is, but it is not, so.
Okay, I was just curious.
Yep. Sure.
I know some social security offices are closing. What is the best way to contact social security?
So you can contact Social Security online. You can go online. You can call them, set up a set appointment. And it's right in Norway too, right? The Social Security office.
I wasn't sure if
Yeah.
that was
Yeah.
yours, okay.
It's the phone number and phone number. Good to know that with an appointment. Yeah.
That's what I was supposed to make it.
All right, well, we have 2 more slides on Medicare, and it's just showing you what Medicare covers and what it leaves behind. So if you have Medicare alone and nothing else, and you went into the hospital, you would be covered your first 60 days after you paid an initial deductible of $1,632. If you were there for more than 60 days, then you start to have a daily charge of $408. And at D91, you start to have a daily charge of $816. So Part A of Medicare works off of a benefit period. A benefit period starts the day that you enter that facility and ends when you've been out for 60 consecutive days. So an example would be, let's say you're in the hospital for 10 days. The most you're gonna pay is that $1,632 for that hospital stay, the room and board, lab, equipment. If you go home for a couple days and you go back into that hospital, you're not gonna pay that deductible again, because you haven't gone home for 60 days. If you go back in after day 10, they count day 11, day 12, day 13. But the same example, if you went home for 4 or 5 months and then you went back in, well, now you've been home for 60 days, even if it's the same calendar year, it's gonna be a new admission, day 1, day 2, day 3. So that's how Part A of Medicare works. And also under Part A is the skilled nursing facility. A skilled nursing facility, you do need to be admitted in the hospital 3 days prior. As long as you have that, then Medicare covers you the first 20 days at 100%, but day 21 through day 100, you would pay $204 a day. So that's Part A. Part B, a lot easier to understand. Part B is all of your doctor care and your outpatient services. It has a calendar year deductible, January 1st through December 31st. It's $240. After you pay that first $240 of your medical care every year, Medicare covers you 80% and you pay 20%. So an example might be you come on to Medicare, you saw a doctor, it's $1,000. You're gonna pay $240. That's the first time. After that, you don't pay that deductible again, and it's really an 80-20 plan for services after that. As I mentioned earlier, Medicare A and B does not cover prescription drugs. We'll talk about that a little bit later in the presentation. And Medicare covers you anywhere in the U.S. and our territories, but not worldwide. It doesn't add in the routine vision or hearing, money towards glasses, or dental care. And the Medicare and You handbooklets go out every year around this time. Some people have already gotten them. If you haven't, they should be here in the next week or so, and it will spell out all this information for you.
Can you suggest something?
Sure.
That 3 days stay has to be before admit and not observation.
Mhm.
You have to be sure that the doctor puts you in a 3 day full stay.
Sure. Her comment was just like to be able to go into the skilled nursing facility, you need a 3-day admission instead of a 3-day observation. So a long time ago, not a long time ago, a few years ago, people were getting stuck because they were in observation, and then the skilled nursing wasn't covered because they didn't have that 3-day stay. There is a law now though, when you're in the hospital, they need to let you know what status you're in, whether it's observation or admission, so you're aware of that. Thank you. All right, any last questions on Medicare before we move on? All right, so now what we're gonna do is we're gonna say, all right, I understand Medicare, 80-20 plan, some deductibles, I go to any doctor, any hospital I want that takes Medicare, maybe that's good enough for me right there. Or you're gonna say, well, maybe I want more coverage, I'm worried about that 20%. If you are, one of the pathways to go down are called Medigap plans or Medicare supplement plans. If you've done some reading, it gets really confusing with the terminology because those two terms are used interchangeably all the time. You could be reading about a Medigap plan and then they're calling it a Medicare supplement plan. Exactly the same thing. They're a type of plan that you buy from a private insurance company that fills in the gaps where Medicare leaves off or supplements where Medicare leaves off. So these plans are always going to pick up the 20% that Medicare left behind. If you're on a Blue Cross plan, we even confuse it more. We call it MedX. So if you have a MedX plan, you're on a Medigap or Medicare supplement, whatever you want to call it. But these plans, again, picking up the 20% where Medicare left off. The job of these plans is that Medicare is your primary insurance. So Medicare is always paying first. The health plan is secondary. It's waiting for Medicare to pay. And when Medicare pays, it's a Medicare benefit, and there's a leftover amount, these plans are there to help pick up that leftover amount. They're not there adding in a whole bunch of extra benefits. So you don't see the dental, the drug coverage, the money towards glasses. The concept is that, again, Medicare is primary, so you can go to any doctor, any hospital that takes Medicare, no referral. You're not calling the health plan to look at that provider directly, look good. Medicare pays first, health plan pays second. So lots of freedom of choice. The 3 plans that are offered in Massachusetts, you could buy them through Blue Cross, you could buy them from other companies. They're regulated by the Division of Insurance. And the name for them are Supplement 4, Supplement 1A, and Supplement 1. How many Blue Cross members do we have in here? here? Anybody on the medics? So quite a few of you, okay, so just for the Blue Cross members, the supplement one, we brand it and we call it Medics Bronze. The supplement 1A is your Medics Sapphire, and the supplement core is the Medics Core plan. You could call us, we'll know those names. You call a different company, they'll know the generic terms. Sure. Supplement 1, if you're on Blue Cross, a Blue Cross member, that's the Medics Bronze plan. Supplement 1A is the Medics Sapphire plan, and the supplement core is the Medics Core plan. You're welcome. We still have Medics Gold. People are grandfathered in, but it's no longer sold. Okay,
Is there, Blue Cross Blue Shield, bronze without the medics?
Is there a Blue Cross and Blue Shield Bronze? Yep, it's the Bronze plan of Blue Cross is that supplement 1 plan.
Okay, but it is the medics.
It is, yeah.
It is?
Yep.
Can you give us a range of what the monthly premiums are for these
Yeah, of course.
programs? And when you say it covers the 20, does it cover it completely, or are there gotchas and surprises at the end of the day?
Yeah, there's no gotchas and surprises, so we'll go through it. So let's go through the slide and then we'll take some questions on it.
Isn't that one on the right only eligible if you have to be eligible by that date that's
Yep.
on there? Okay,
Yeah.
so.
We'll go through it all, so, and then I'll take some questions after, so I don't need to do that. So supplement core, supplement 1A, supplement 1. Ranging in price. Supplement core, starting around $120 per person per month. These are individual plans, so if you're a couple, remember you can take different ones, but there's no family rate. It's individual once you go on to Medicare. So supplement core around $120. Supplement 1A starts around $200 something. Supplement 1 starts around $220 something. Every company is going to have a little bit of a different premium because they have different membership that make that up. But again, these are regulated benefits, so you'll never have less than what's on this board. I'm going to start with the supplement 1 plan because that's the easiest plan to understand. So for around $220 something a month, when you look at this chart and you see the check marks, it means that you have no cost for those Medicare covered services. So if you go to the hospital, you pay nothing. Skilled nursing, doctor care, labs, x-rays, you've paid that $220, $240, whatever premium of the plan that you chose, and that's going to be the cost of your medical care that year. You have a $10 million hospitalization, or you have no care. It's $220 times 12, and that's the cost. So very predictable cost. And again, these are not Blue Cross figures, just giving you a range of what these plans are.
Is that the bronze or the sapphire? Or you just-
The supplement 1 would have been around the bronze plan, similar to the bronze plan. The
Can't get that.
So you cannot get it, yes. Some people can and some people can't. So I promise I'll go back to it. We'll just go through it first and then I'll take the questions. So it will be a little clearer if we just go through once and then we'll take the questions. So supplement 1, around $220 per person per month. Every check mark means that it's covered out 100% or no cost sharing for you. The next plan that you could look at would be the supplement 1A plan. That plan is exactly the same as that supplement 1, or it's the twin of it, minus one thing, the $240 Part B deductible, or the Part B deductible each year. So when you look at that plan, supplement 1A, and we say it's about $200 a month times 12, plus you're going to have to pay that Part B deductible, the $240. That's the cost of your medical care that year. So doctor, lab, x-ray, hospitalization, $10 million worth of care, what are you gonna pay? $240. After that, every time you go to the doctor, lab, x-ray, covered at 100%. It's a one-time yearly deductible. So that's why I say it's almost the same as that supplement one, just that small difference.
And the drugs.
Yep, we didn't go, it's the same as that supplement one, they both don't cover drugs, yep. And then, the supplement core plan, that runs around $120 per person per month. And I always think it's easier to talk about car insurance than health insurance for some reason. So if you think about car insurance and you say, I'm taking a car insurance with no deductible, you know you pay a higher premium. You say, I'm taking a car insurance with a higher deductible, you're paying a lower premium. And that's just like that supplement core plan. So around $120 a month. If you end up in the hospital, you are gonna pay that $1,632. If the hospitalization was $10 million, you would have paid nothing on the 1A or the 1, but you still would have just paid the $1,632 on the core. Going down the benefits, skilled nursing. Medicare covers you the first 20 days after that 3-day hospital stay. If you're still there at day 21, on the core, you are going to pay $204 a day for that skilled nursing. Supplement core and supplement 1A, both have you pay that Part B deductible. And then after that, all those plans are picking up that 20% that Medicare left behind. None of these plans are adding in prescription drug coverage. Here outside the U.S., Medicare only covers you in the U.S. This is an exception to the rule. The 1A and the 1, they do cover you worldwide. Typically, you're going to need to pay upfront, come back, be reimbursed minus the plan design. You'll see the core does not have a check mark. It's not regulated that these plans have to cover you on the core outside the U.S. Blue Cross and many of the other carriers do, so you can always check that benefit. But I just want you to know what the minimum standard always would be. We never have less than what's on this slide. So now back to the question, can I take the Supplement 1 plan? So the Supplement 1 plan is still offered, but because that plan covers everything that Medicare left behind and has no cost sharing, there was some legislation, I can't even speak tonight, that said after January 1st, 2000, if you were eligible for Medicare prior to January 1st, 2020, you can always choose the Supplement 1 plan. But if you're saying, I'm just turning 65 now, or I'm just eligible for disability through Medicare right now, well, you weren't eligible prior to 1/1/2020, so you can't enroll in that Supplement 1 plan. Really, it's not going to matter because if you do the financials out, most people are going to make out better on that Supplement 1A plan. So the premium, when you do it out, as long as you don't mind paying that Part B deductible, is usually less expensive than that Supplement 1 plan. So I know we had a lot of questions and then we went through it. So now, any questions at all on these supplement plans? Sure.
Can you only get a supplemental plan when you first sign up?
Great question. Her question was, can you only get a supplement plan when you first sign up for Medicare? So if you, again, you must have done some reading. You'll see that a lot, that there's only a certain time that you can sign up for these Medicare supplement plans. That is true in other states, but not in Massachusetts. Our supplement plans in Massachusetts are actually the most flexible. These plans, you can come on at any time if you have Medicare, and whenever you send in your application, you'd be effective the first of the following month. If you're on another Medicare supplement plan, you can swap. If you're a member, let's say you're a member of Blue Cross, and you say, well, I'm on that Medix Bronze plan, and now I want to move down to the Supplement 1A, or I go to the Supplement 1A, and I want to move it back up to that Supplement 1, You can do that every month. You call member of service, whatever month you call us, we'll move you up or down the first of the following month. So Massachusetts Medicare supplement plans, no pre-existing conditions, no health screenings, continuous open enrollment, so lots of flexibility with these plans. This slide, if you decide to retire in a different state, let's say you're South Carolina or California or wherever you may go, you're not all gonna follow that. There's gonna be certain times that you can enroll, and there might be underwriting guidelines as well. So you just wanna be aware of that. But the concept will be the same, that in other states, you'll be able to choose a Medigap plan, you'll pick up the 20%, you'll be looking at the monthly premium, and what are the other deductibles and cost share that those plans pick up. So I'm just going back to this slide. Any last questions on the Medigap plans?
I just have one.
Sure.
So if you have the supplement one, and you change, and next year you change to the 1A, and you say, oh, this isn't for me. So you have the 1A for 3 years, can you go back to the supplement one if you had it years ago?
Absolutely.
Okay,
Yep.
thank you.
So her question is, if you're already on the supplement one, and you wanna move down to the supplement 1A, and then all of a sudden, a couple of years from now, you don't want it anymore, you wanna go back to the supplement one, you can certainly do that. It's whatever month you call, they'll move you up or down the first of the following month. Sure.
So that pricing is the same, whether I'm 65 or 95 to take this plan, whether I have pre-existing conditions or not?
You got it. So the pricing will be the same regardless of your age or your condition, for the most part. So when I say for the most part, it's a group rate, so everybody pays the same. But sometimes the health plans, like for example, Blue Cross, we give an initial 3-year discount for anybody joining within 6 months of their Part B effective date. So you might get a little discount when you first join on different companies, but every year it doesn't go up because you've aged or conditions. It's just a group rate, typically change every January 1st.
Another question. So each carrier, Cigna, Tufts, Blue Cross, whatever, would offer those 3 basic plans?
Yes.
And they're called the same,
Yep.
no matter what the carrier is?
Yep. So her comment was that whether you're Blue Cross, a different carrier, Tufts, whoever, they're gonna offer these same 3 plans, and the answer is yes, because they're regulated by the Division of Insurance. So we all might add little extras or little differences, but you'll never have less than what's on the screen.
So if you signed up for one of these plans here in Massachusetts, and say you move the next month or 2, does your plan come with you, or are you still covered effectively until you get these switched?
So if you take one of these plans, the supplements, and you move outside of the state, you can keep these plans with you if you choose to do so, or you have a special enrollment to change to a different carrier. So these ones can transfer with you.
Do the rates change depending what state you're in?
The rates would change, if you, no, the rates would not change if you enroll now, you're Blue Cross and Massachusetts member, or you took a different carrier, and then you left the state. Well, I'll speak for Blue Cross because I'm just not sure, but if you moved outside of the state, you would have the same rate that you, as everybody else on that plan. So again, it's, you're having the Blue, like if it was Blue Cross, it'd be the Blue Cross and Blue Shield of Massachusetts, maybe you're living in Florida or California, but it's the rate that you had while you were here.
I have a friend who has a supplement or a Medigap, and she told me that they pay that Part B monthly, included in what she pays for that supplement. Is that true?
Absolutely. So good question. Her question was, her friend said she pays the Part B premium in addition to the health plan. And if I wasn't clear, yes, that's always going to be the case. So you need to have Medicare A and B before you join any other plan. No matter which pathway you go down, Medicare A and B is your starting point, you need to know that, and you need to know your effective date before you could join these plans, because again, Medicare is your primary, and then you bought a secondary insurance, and you're sending that premium to the secondary insurance.
So a supplement won't pay that Part B deduction every month.
The supplement plan is not gonna pay that $174.70,
Right.
if that's what you're asking, no. That's your job, you need to have Medicare A and B.
Yeah.
You could stop right there and say, that's all I want,
Mhm.
but if you want more, then it's a premium to the insurance that you're choosing. All right. Yes,
Do those, rates change annually also?
yes, they do. Do those rates change annually? The supplement plans change annually. Most companies change for January 1st, some companies change July 1st. Blue Cross, we change January 1st every year. Yes.
On the supplement 4, that Part B coinsurance is 20%, what is, I missed what you said about that payment, because that has a check mark, so what does that cover?
So Part B of Medicare, on the supplement core, so let's say you choose the supplement core plan. This is somebody that might choose the core. They might say, I'd like to pay $120-something a month. I'm not worried about the hospital. I haven't been in the hospital in 30 years. So I'll take my chances. If I end up in the hospital, I'll pay the deductible. So what would you get on that plan? If you never ended up in the hospital, you were gonna have to pay your first $240 of your medical care every year if you had it. But after that, every time you went to the doctor, lab, x-ray, you pay nothing. So it's picking up that 20%.
Okay. Thank you.
You're welcome.
So you said you can flip between these plans
Mhm.
monthly, so like if you were going in for an elective or
Yeah.
something, you would be on the door and then switch.
Sure.
Switch
Yeah.
prior to you going for.
Yeah, it's a nice feature because people will say, well, can I switch if I know something's coming up? Absolutely. So if you're on the core, you say, I'm not worried about that hospitalization, and then you go to your doctor and your doctor says, hey, a few months from now, I think you're gonna need this inpatient surgery, or you can switch whatever month you call, they'll move you up or down the first of the following month. You can switch if you're in an ambulance going to the hospital. But when you call, they're gonna switch you for the first of the following month. So it's too late at that point. Like if you go in the hospital, it's that month you're paying your deductible, but it would happen for the first of the following month.
A lot of services where they are allocated, right? So you, that 1632 would apply, that would just be your based on
You got it. Yeah. So her comment was a lot of stuff is outpatient now, so the outpatient would apply to that 1,632, and that's correct. Outpatient would be the Part B. All right. So we are moving on, and if you're worried about time, we have 10 minutes left, and I certainly can stay after if people have questions, but we are on track if you're worried. So we may be a couple minutes over, but I'm not keeping you here till 9, so don't worry. So now we talked about Medicare 174. We talked about the supplements 120 to 220 or so. Those change every January. So if you've done some reading, it does sound like some of these Medicare plans will be going up coming this year, but we will see. For the Part D is good news for this year. So Part D is prescription drug coverage, and prescription drug coverage, or Part D prescription drug coverage, can be obtained in one of two ways. The first way is what I'm talking about right now. We have Medicare, you buy a standalone Part D plan. We have Medicare and a supplement, you buy a standalone Part D plan. Those plans can range anywhere from, let's say, $12 to over $100-something a month. What they're gonna do is they all, again, there have some standardization that's set by the Center for Medicare and Medicaid Services. And this is the 2025 information. The way that these plans are gonna work in 2025 is there's gonna be an initial phase and a catastrophic phase. The initial phase means you're gonna have plans that, just like your work plans, you're gonna look up your medications, and depending on your medications, how they're covered, you're gonna pay some co-payments or cost to take home those medications. By paying those co-payments and costs, if you ever paid $2,000 out of your pocket, you hit that last level of coverage called catastrophic, and then you no longer pay. This is a big deal because last year, the catastrophic coverage, you could have paid $8,000 out of your pocket. 2025, it's capped at $2,000.
That was in the inflation reduction.
You got it, yep, yep. And if you heard of the donut hole or the coverage gap, that's all gone away. So it's so nice not to present it. And I'm so glad it's reduced everybody's potential cost. So the way that Part D is gonna work is some plans may still have a deductible. If they do, it's capped at $590. It can never be more than that. And then again, it's just like your work plan. You're looking at your medication, you're paying those co-payments and costs. If you ever pay $2,000 out of your pocket, the remainder of the year, you no longer need to pay. So to find the best Part D plan, it's going to be based on which plans cover your medications, which plans are going to be the lowest out-of-pocket cost for you based on co-payment and the premium. And the best way to always do that is you can talk to your pharmacist. Sometimes they'll run the figures for you. You can talk to Shine, Serving Health Information Needs of Everyone on Medicare. They're volunteers at your local council on aging center that will sit down with you one-on-one and go over this information. I'll also have another resource called Mass Medline. You can call and give them your medication. Because at the end of the day, it really doesn't matter if you're paying, $10 a month, $50 a month, $100 a month. What you want is a plan that covers your medication and that you're paying the least amount of money out of pocket for both co-pays and premium. And there's a whole computer system that will do that for you. Something I want to note too is that Part D is optional. You don't need to take Part D, but if you don't have what the government calls creditable coverage, prescription drug coverage as good or better than this, and when you're initially eligible for Medicare, if you don't take it, and you later on want to get onto it, you could get a late enrollment penalty. So sometimes you'll find people say, well, I have Medicare, I have a supplement, I don't take any medications, I'll wait until I need it. That's how you can get that penalty. So if you don't take any medications, a lot of people will just take the least expensive plan. You can always change it every year.
And what is the approximate cost for drug coverage?
In 2024, the plans range from 50 cents a month to over $100 a month, with the average being around $50. In 2025, I know the Medicare booklet just came out, so I think that 50-cent plan, or one of the lowest, is about $12 this year. So we'll see. All right. So we went through the hard part of this presentation. We talked all about Medicare, the supplements, the Part D. As I said earlier, that's the most expensive monthly pathway for the least amount of money out of your pocket. So if you're saying here, you know what, this is crazy, I didn't know Medicare costs money, and then I don't want to pay the supplement and the Part D, I'll say hold off because we're going to talk about this different pathway. But then other people might be here that said, you know what, I was thinking I had to work until I was 90 because I was worried about losing my health insurance. But you can see that a supplement plan, you could pay $200-something a month, any doctor, any hospital, everything's covered. So you can find just as good of medical coverage sometimes as your employer plans. So what works for you is really, when you think about what's my situation, those weights and balances of importance. So not everybody's going to have the same opinion on what's the best plan because everybody's different. So now we'll talk about the Medicare Advantage plans. These are your medical and prescriptions all in one with extras. And you probably, if you're on a supplement plan or if you've seen these ads for zero premium plans, a lot of times people think, well, how can that be? Is it too good to be We don't get something for nothing. And it's just a very different way that these plans are funded. So what happens is, if you choose a Medicare Advantage plan, Medicare is gonna send the health plan that you join a set amount of money every month for every member that joins the plan. So the health plan might get around $1,000 per person per month. You take a zero premium plan, you don't send any additional premium. Take a $50 plan, $100 plan, you send the health plan that premium. We take the Medicare money, your money, we pool it all together, we contract with doctors and hospitals, we give you all of your Medicare covered benefits, plus additional benefits that Medicare doesn't cover. So again, on these plans you see, a lot of times you'll see dental, you'll see money towards glasses, the drug coverage is embedded, it's the same model that we just went through. In exchange for that, you always still need to continue to pay your Medicare premium, so that still doesn't go away, that $174. But now when you go to those doctors or those hospitals, you show your one healthcare card, you no longer show Medicare. If you showed your Medicare card, they billed Medicare, Medicare would say, hey, we already prepaid that plan to take care of you. So you show them the one healthcare card, they bill the health plan, we pay the claims out of that pool of funds, but again, you're always paying a co-payment or cost along the way. The types of plans available to you are going to be HMOs and PPOs. HMO is a health maintenance organization. When you choose an HMO, you need to choose a primary care doctor and receive referrals. A lot of times people say, well, I don't want to take a Medicare Advantage plan because I don't want to have referrals. Well, you can take a PPO plan, they don't have referrals. So PPO is a preferred provider organization. When you choose a PPO, you can stay in-network to contracted providers or go out of network to any Medicare provider. So in-network, you typically pay less, out of network, you typically pay more. Again, the most popular plans are typically those zero premium plans. So an example might be, let's say you said, well, last year I went to my doctor 10 times. And you look at the Medicare HMO or PPO plan, and you look up specialists, and it says the specialist is $50 a visit. You're like, well, I went 10 times, that's $500, but that's all I did. Now, somebody that took a zero premium plan and they went to the specialist 10 times and paid $500, they made out great. They had medical, prescriptions, they had a lot of extras on that plan. They do it again the next year, but the next year they have a really bad year. So they're in and out of the hospital, labs, x-rays, skilled nursing. They're paying a whole bunch of co-payments and costs along the way. And they say, oh no, I'm gonna pay $20,000, $30,000 out of pocket. That's not gonna happen on these plans. What happens is that there's always an out-of-pocket max. So at Blue Cross, we have 4 HMOs, 2 PPOs. Other carriers are gonna have that same type of portfolio, a lot of health plans for you to choose from. Each one of those plans will have a different little set of benefits for co-pays and costs when you go to doctors. But they're also gonna have different out-of-pocket max. And an out-of-pocket max is the most that you could pay for your Medicare coverage services in a given year. So let's say you take a zero plan and it's $5,000, $6,000, $7,000, whatever it is for the out-of-pocket max. You know you're going to doctor, lab, x-ray. If you ever hit that, that's your limit. So the next time you go for that care, you no longer pay. So there's a risk factor that if you have that bad year, you could hit that out-of-pocket max. Most people don't, but it's there as a protection for you. So again, it's the weights and balances of what you're looking for. The other thing is, nothing is a lifetime commitment. So when you first go on to Medicare, everything opens up to you. Outside of that, if you're in Massachusetts with those supplement plans, you can change your back and forth every year, October 15th through December 7th, for January 1st effective date. If you're on a Medicare Advantage plan come January 1st, you get one extra time to change it until March 31st. And I always say, if you ever find yourself on the wrong plan, call your healthcare carrier or talk to Shine. If you qualify for any type of special enrollment, they will try to help you find it. we went through this slide, this was for the higher income. And this slide is for resources. Here is the Medicare number, Social Security. I mentioned Sean in Mass Medline to help finding Part D plans or looking at your health plans. Prescription Advantage is a program that helps with prescription costs for Massachusetts residents. And the Blue Cross number is there. So today, again, it's not a presentation that anybody should know exactly which health plan that they are on. And sometimes it's a lot of information, so you might feel like, I'm so overwhelmed I don't know, but I promise you, you do. You now know when and how to enroll into Medicare. You know, that's your starting point. You need Medicare to join any of these plans. And then when you're looking at that product information, if you're looking at supplement plans, you know they're higher cost because you have no co-payments. You're picking up where Medicare left out, but you need a drug plan. Or if you look at those Medicare Advantage plans, you know, lower premium, medical extras, but look at what your risk factor is for that out-of-pocket max. If you're looking for product information for January, for the 2025 benefits, whether you're a Blue Cross or anybody else, that's always released October 1st. You can always give us a call, go onto our website. We do sales product presentations at the Dedham Holiday Inn, it's probably the closest here. Sometimes at Mansfield. And the other carriers will do the same, I'm not sure the same locations, but you'll be able to find that product information. And now you kind of have the base to be able to look at it. So that is it for the Medicare section. The last section, I'm just gonna look at time for 8:03, so I can do the next section in 2 minutes, and then we'll take some questions. Just so I make sure everybody gets the information they needed. So if you need coverage prior to Medicare eligible, your options are really gonna depend on what you have access to. So we have them in order of what typically works best for most people. Spouse or partner plan, COBRA, or direct pay. Spouse or partner plan is very easy. You're working, your spouse is working. One retires, you lost your health plan. If your spouse's employer offers insurance as a qualifying event for you to go onto their plan. Usually the best bet, because if an employer is offering insurance, you're paying some of that premium. Not everybody's going to have that option, so you might look at COBRA, which is temporary continuation of group coverage. Employees are generally 18 months, spouse and dependents are typically 36 months, or 18 to 36 months. COBRA is easy because it's the exact same plan that you had while you're working, and the company's going to tell you what the rate is, because they're no longer chipping in towards it. So you can take your COBRA rate, you know your plan, and you can compare it in the direct pay market. In the direct pay market means you're calling a carrier directly. I always say get the highest cost plan and the lowest so you know your range. Work it to compare it to the COBRA. Usually COBRA is going to be better. Not always the case. Example, individual coverage around age 63, you're probably middle of the line product. You're looking at $800 to $1,000 a month for that plan. So it's an expensive time for a lot of people. If you qualify based on income, you can always go to the Mass Health Connector for subsidized plans. And if you do, they don't look at your assets, just your income, and then you can buy a very affordable, good plan through the Mass Health Connector. All right, you did it. We made it through a long presentation in a crowded room. I couldn't be more pleased that all of you came out and gave us your time tonight. Any last questions for the group?
Sure. Medicare Part D prescription plan, once you choose one, say it's for January.
Yep.
And you're not happy with it, can you change that?
For the Part D in the Medicare Advantage, you can always change, but not like the supplement back and forth. It's going to be every year that October 15th through December 7th.
No, I mean, if you choose one in January, say, oh, I don't like this, is there anything you can choose? Can you change your mind?
You can't, no. On the Part D, once you choose it, you're kind of locked in for the year. The only exception it would be like if you have that prescription advantage program, they give you one extra time to change. If
One
you-
extra time during the year?
Yeah, if you're on that prescription advantage assistance
Just
program.
one time?
Yep,
Thank you.
you're welcome.
So if you go to, like, I go to Florida for like 5 or 6 months, can I have my own set of doctors down there but be on a Massachusetts plan?
Sure, yeah. So if you go to Florida for like 6 months, I wouldn't recommend the HMO because if something comes up, you're only gonna have urgent or an emergency care. But if you are on a PPO or a supplement, especially the supplement, you can go to any doctors nationwide.
The 1A.
The 1A, yeah, or the 1, yeah.
Yeah, I don't think that Medicare Advantage are very good if you're splitting your time.
For Medicare Advantage, HMO or PPO, you always have coverage for emergency and urgent care.
That's all.
But the PPO, you can go out of network to see any Medicare provider, and depending on the PPO you pick, it might not be that much different than the in-network doctors.
Okay, thank you.
You're welcome.
Travel outside the US?
Travel outside the U.S., good question. The Medicare Advantage plans are typically only going to be urgent and emergency care, and you typically need to pay upfront, come back and be reimbursed. The supplement plans, the 1A and the 1, and a lot of companies will add it in on the core, they'll cover you for anything you would have been covered for in the U.S., but again, you're paying upfront, coming back and being reimbursed.
Planning on retiring on December 31st.
Yeah, nice.
So when should I sign up for the plan?
Sure, great question. She's retiring December 31st, so going into the new year. So when should you sign up for Medicare? About 2 to 3 months prior, you want to talk to Social Security.
Well, I have Medicare, I was talking about one of these plans.
Oh, once you have Medicare
Part A.
Part A. Okay, so you want to sign up for Medicare Part B to start January 1st. And once you know that you're all set for that, you can join any of these plans to start January 1st.
So I can sign up like during the enrollment period?
You can. You could sign up. As long as you talk to Medicare, you already have the Part B being active this January 1st, you could sign up October, November, December. Yeah. And so like if you hear the open enrollment stops December 15th, you have all the month of December to sign up for January 1st. Thank you.
What about dental?
Dental is a lot of times included in some of the Medicare Advantage plans. You'd have to look at the various Medicare Advantage plans out there. They might usually have some preventative dental. Some have really comprehensive. Some have really comprehensive dental. But outside of that, the supplement plans, they're not going to include any dental. You can always buy a standalone dental plan. They can range anywhere, like I'll speak for Blue Cross, from like $25 to $70-something. Nobody's ever happy with dental because you think, oh, I have this dental. It doesn't work like your medical. Like if you have a medical condition, you know, no matter what the cost of medical, it's covered, you know, until the end. Dental's always going to have a cutoff point, the maximum that the plan will pay, whether it's $1,250, $1,500, but you know, it's like your employer plan too. While you're working, it's still not unlimited. So, but there are policies you can buy.
And Blue Cross does?
We do, yeah. We have one called Dental Blue 65. You don't even need to be on our medical plans. You just have to be 65 and Massachusetts resident.
Some school systems offer retirement for employees. I assume that's a supplemental, you'd still have to pay Part B.
So some school systems offer retiree medical. Yeah, typically, if you take Medicare A and B, there'll be a plan for you, but sometimes school teachers didn't pay into the Medicare system, so there might be another plan that they can still choose without having to have Medicare A or B. Typically, if you have A or B, the plan that you choose will be cheaper.
Okay, thank you.
Yeah.
Do you usually know the rates by the open enrollment period is early and the rates rates kick in January first.
Oh, yeah, you'll
You know
know
what it's
the
gonna
rates,
be.
sure. Any Medicare Advantage plan, Part D plan, the supplement plans come out early too. They all need to let you know the new benefits by October first. And then, October 15th through December 7th is when you can change your plans for January 1st. All right, everyone, I'm here if you have any personal questions. Have a great night.